going to discuss Meniere's disease. I'm first going to tell you about the symptoms of Meniere's disease. There are three symptoms: vertigo, hearing loss, and ringing in the ears. This usually occurs on one side. Patients suffer with vertiginous episodes that usually last from 30 minutes to several hours. During this time they may be nauseated, they may vomit. The hearing usually fluctuates and gets worse during the attacks of vertigo, and also the noise gets louder in the ear. The attacks can come in any frequency. They're very unpredictable. They could come very frequently, or they could come once a month or once a year. Now, what causes it? The cause of Meniere's disease is really not known, but we know what it looks like on temporal bone sections, which shows that the inner ear balloons out. The endolymphatic membranes balloon out, which I'll show you a picture of now. Here you can see a diagram of the inner ear. These are the semicircular canals here, the three semicircular canals, and this is depicting the cochlea. These are the thin endolymphatic membranes that become ballooned out in Meniere's disease. What happens is that the fluid volume continues to increase until suddenly there's a rupture of one of these membranes, at which time there's a mixing of fluids in the inner ear with the high potassium content causes the vertiginous episodes and causes the hearing loss to occur. When the rupture heals, the vertigo stops and the hearing returns to normal. Now, how is this treated? It's treated first with medication. We use diuretics such as diazide to reduce the pressure and fluid volume in the inner ear. Many times this reduces the number of attacks and decreases the pressure feeling in the ear and the noise in the ear. The next thing that we use is steroids in high doses. Prednisone 60 milligrams given once a day for several weeks sometimes stops these attacks from occurring. This happens mostly when we are first seeing the patients early in the course of the disease. The steroids usually don't work when the Meniere's has been present for a period of months. We also have the patients take a low salt diet and not place extra salt on their food, because this seems to incite the attacks of vertigo. Now let me tell you a little bit about the natural history of Meniere's disease. The natural history is that if you don't do anything, after 2 or 3 years, the patients will stop having the vertigo attacks in about 50%. If you wait 8 years, then about 70% will be free of vertigo. Usually the hearing continues to decrease if the inner ear continues to increase in pressure over time. The hearing loss usually stabilizes at about 60% loss, with a decreased understanding in the ear. Now, how do we diagnose this condition? We take a history and find out that the patients are having recurrent episodes of vertigo with fluctuating hearing loss and pressure in their ears. Then we do a number of tests. We do a hearing test to determine how much hearing loss has occurred, or if there is low-tone hearing loss, which we usually see in Meniere's disease. We do an ENG balance study, which tests the balance function in the vestibular portion of the inner ear. In Meniere's disease, about 50% of the patient will show a destruction or a decreased function in the inner ear balance mechanism. We also do what we call electrocochleography, which measures the pressures in the inner ear. This is done with a computer, and that's done in the office. We also measure what we call brainstem evoked response audiometry, which is actually using a computer to measure the sound waves coming from the ear to the brain. We're doing this to make sure that there isn't an acoustic neuroma present or a little tumor pressing on the hearing nerve that could mimic the symptoms of Meniere's disease. There's another test that we do. It's called autoacoustic emissions, and that measures the little hair cells in the inner ear, how they function. And in Meniere's disease, many times these hair cells are not normal. Now let me talk a little bit about the treatment when the medications don't seem to control the attacks of vertigo. first treatment is gentamicin treatment, where we take gentamicin and place it into the inner ear fluids. We have had different methods of doing this in the past, injecting it through the eardrum and placing it on gel foam in the round window area, which is right here. Recently, I developed a new technique using a micro wick. The micro wick is placed through the eardrum through a small vent tube that's placed in the eardrum. And the micro wick extends down to the round window membrane, which is similar to the eye in that it will absorb fluid or medications placed on the wick. This gentamicin, which is a dilute solution, usually 10 milligrams per cc, then flows into and is absorbed into the inner ear fluids and acts to destroy a portion of the balance mechanism. This will help relieve the attacks of vertigo in over 85%. During this time, there is also some toxicity to the cochlea. Most of the time, hearing is not damaged using this medication, but it can be made worse in some cases. About 1% of patients will actually lose all their hearing in the ear from this treatment. The treatment has been very, very successful, and it has avoided the need for doing major surgery in the hospital. This procedure is done in the office, and it's done under local anesthesia. The patients go home the same day, and there's very little discomfort with it. Patients put the gentamicin in their ear canal 3 times a day, 3 drops, and they usually do this for several weeks. We test them each week with a balance test and a hearing test to monitor their hearing and balance function. And when the balance center has had enough gentamicin to cause a reduction in vestibular response, then we stop the gentamicin. This will usually take care of the vertigo attacks while preserving the hearing. In 1978, I developed a technique to cut the balance nerve by going behind the ear. An incision is made behind the ear, and then we expose the mastoid bone and take some bone away from the lateral venous sinus and the endolymphatic sac here. After doing that, we then make the incision behind the lateral venous sinus to expose the brain and the nerves going from the inner ear to the brain. Here you can see a picture of a transected vestibular nerve in the right ear. During this procedure, we preserve the hearing nerve and the facial nerve and all the other nerves, cranial nerves. This operation we have done in over 250 patients. We've had excellent results throughout the years, but with the use of the gentamicin self-treatment method that I just discussed, most of the patients are not having vestibular neurectomy. We use this for failures of the gentamicin treatment. And a few of the patients do have failure from this treatment, but it is very few. Actually, the number of vestibular nerve sections has greatly decreased since we started using the gentamicin. The complications have been very infrequent. The results are excellent, being 95% cure of vertigo with preservation of hearing in 80% of the patients. When the patient's hearing is very poor in the ear and the gentamicin treatment has failed, what we do is what we call a labyrinthectomy, where we destroy the entire inner ear. We remove the balance mechanism and the hearing portion of the ear. Patients are deaf after this operation, and obviously we don't do this procedure unless the hearing is quite poor in the ear. But this operation is done under general anesthesia. The patient is it's done through the external canal. We put a speculum in and make a small incision in the skin. We remove the little stirrup bone, the stapes bone, and then remove the membranes of the inner ear. This is a side view showing the instruments going in to remove the membranes, the balance canals, the utricle of the inner ear. In this operation, most of the patients are cured of the vertigo in over 95%. Of course, they've lost their hearing. In half the patient, the tinnitus in the ear is better. The pressure in the ear is better in about 50% of the patients. The skin of the ear canal is placed back and packed in place for several weeks, and the patient usually leaves the hospital in 1 or 2 days after the vertigo from the procedure subsides. Today, we can make a diagnosis of Meniere's disease, and most patients don't have to live with their vertigo and dizziness as they have in the past. Many physicians throughout the country will tell the patient there's no treatment for this condition and they will have to live with their dizziness. This is not true. With the various techniques that we have, the gentamicin, the vestibular neurectomy, and the labyrinthectomy, we're able to cure the vertigo attacks in almost every patient with Meniere's disease. Thank you. Hi, welcome to the Ear Research Foundation. I would like to tell you about our foundation that was started in 1979. It's now 20 years, and the foundation has been a dream of mine since starting early in medicine. The purpose of the foundation was to establish a place where research could be done to improve patients' hearing, and also to improve patients with dizziness and with imbalance. We have made great strides for the last 20 years. The other parts of our program have been education and also treatment. We have actually run out of our facility space, and we need a new building. And we're going to start construction shortly on a 3-story, 22,000 square foot building on the property that's owned by the foundation on Floyd Street. This building will hold the Ear Research Foundation, the laboratories for the foundation, administration, the research area. It will have the Florida Ear and Sinus Center offices, an outpatient surgical facility, and the Medical Hearing Aid Systems Department. I'd like to tell you a little bit about what we've done in the past 20 years as far as our accomplishments go. We've seen over 27,000 patients in our clinics. 9,000 of these have been children. We've done over 2,000 surgical procedures on patients. This clinic is an indigent clinic where patients can come where they can't afford the private physician. We've done cochlear implants for totally deaf children in 15 cases where we've found funds and helped subsidize these children who have no funds for their surgery and rehabilitation. In the early 70s, we were one of the first to talk about conservative management of acoustic neuromas. Another thing that I developed at the Ear Research Foundation in 1985 was a device called the Silverstein Facial Nerve Monitor. This has a little clip here. It's a very simple device that clips onto the mouth, and whenever the facial nerve is stimulated, the mouth moves and a bell rings inside this monitor. This is a little handpiece that has a probe that you can stimulate the facial nerve during surgery. We have used this in every case since 1985. Over 2,500 cases have been done with this monitor. And we have saved the facial nerve in many cases where it may have been damaged without the use of this monitor. Now let's talk about Meniere's disease a little bit. In 1978, I developed a procedure to correct and cure the vertigo of patients with Meniere's disease. Meniere's disease is a disease where the patients have recurrent episodes of vertigo, hearing loss in one ear, balance difficulty, and also ringing in the ears. The procedure that I developed is done behind the ear. We remove some of the mastoid bone,
open up and we can see the nerves going from the inner ear to the brain. We can see the facial nerve here, we can see the cochlear nerve and the vestibular nerve, which is cut in this case. When you cut the vestibular nerve, the patient no longer has any more vertigo spells. They continue to have their Meniere's symptoms of pressure in the ear and ringing, but their vertigo attacks are completely relieved. These patients are very, very happy for the surgery. We've done over 250 of these procedures since 1978. The results have been excellent, and the complications have been infrequent. The micro-wick was developed about a year ago. This is a small wick that we place through the eardrum after we put a vent tube in the eardrum, and I'll show you a picture of this shortly. This wick goes down and is attached and lays against the round window membrane. The patient then treats themselves with a dilute solution of gentamicin, 3 drops 3 times a day for several weeks. The drops go down the wick into the inner ear and slowly destroy the balance center and preserve the hearing. This has become a very successful treatment, and actually the number of vestibular neurectomies has decreased dramatically in the last few years since we've been using this conservative technique that we've developed that can be done in the office. In about 40% of the patients with otosclerosis, there's minimal otosclerosis, just fixing a small portion of the stapes in this area. What I've developed is a simple procedure with a laser where we cut the foot plate of the stapes here and we make a cut here. What this does is it separates the fixed part of the stapes from the mobile part of the stapes and preserves the stapedius tendon here. This is a minimally invasive procedure, and what happens is this part of the stapes becomes mobile and the patient's hearing returns to its normal state. For the past 15 years, I've been studying jazz piano, and I've made 5 CDs. The reason I'm telling you about this is because I've used these CDs as a fundraiser for the foundation. We've been very successful to this date and have raised $40,000 giving these CDs away to our patients and our friends. That's a rundown on a number of our accomplishments, research, developments throughout the past 20 years. We're looking towards the 21st century to make further breakthroughs in medical science. I would like to say that I'm very proud of the 24 fellows that I've trained. These doctors have gone throughout the country, and many of them are in academic positions and are professors in their department. That's the story of the Ear Research Foundation here in Sarasota, Florida. We're very excited about the new prospects of our building and for the new developments in the 21st century for research, education, and treatment of our patients. We hope that you would like to join us and become members of the Ear Research Foundation and make donations to our new project. If you'd like information, you could call us at 366-1148, area code 941. Our webpage is www.earsinus.com. Thank you and goodbye.